Okay, well, I think we're going to get started. I do see we have a great lineup of participants joining us today. Um, Welcome to the first introduction to Devoted Health in Ohio. My name is Mike Walker, and I'm the network leader for Devoted Health here in Ohio, and I'll be your host today. We have a couple of speakers who will also be joining us as well. I just want to welcome everybody. We're so pleased with the great turnout that we're getting, and we really appreciate that you all have joined us today. You've taken an hour out of your day to learn a little bit more about who Devoted is and some of the great reasons why you might want to work with us. This session is going to run 60 minutes. We're going to try to finish the presentation within 40 to 45 minutes. We want to allow plenty of time for questions and answers. And in doing so, we would ask everybody's muted who is actually watching this presentation. So we'd ask that you use the Q&A feature in the Zoom window to ask your questions. And we will do a full review of those questions at the end of this presentation. And there may be some typewritten responses during the presentation as appropriate. I also wanted to mention that all participants will receive a follow-up email link to this recording, and we're also going to send a copy of the actual presentation as well. There are live links in the presentation that will actually give you access to information that you want to use in the future. And one final note, this is a virtual meeting. Unfortunately, we'd love to be face-to-face, and I hope someday in the future we'll have that opportunity. I'm sure we will. But we did offer gift cards for lunch, and folks who registered should have received those gift cards by now, unless you registered most recently. We did notice, we found out that there is a small number of gift cards that were not properly activated. And so if your card is one of those, we apologize. And I also wanted to extend an invitation that if you send your name and contact information to the OH-provider-relations@devoted.com, we will make sure and send you out an activated lunch gift card. And that website is posted actually in the presentation. It's a general mailbox that you can contact us for provider questions. And we'll also post it in the chat function on this presentation. So that's all of the housekeeping items. I want to introduce now Rich Waldron. Rich Waldron, many of you I'm sure know Rich. I've worked with him for more than 25 years. In the health insurance business here, located in Northern Ohio principally. And he is our market president for Devoted Ohio. So Rich, I'm going to let you introduce us.
Thanks, Mike. Very nice introduction. I'm really glad to be speaking with all of you, but as Mike pointed out, it'd be wonderful if we could all be face-to-face, be with you in person, maybe at our offices. We do have Cleveland offices. Instead, I'm broadcasting from our studio in Lyndhurst, Ohio, better known as my spare bedroom. I really do want to thank everybody who's joining us today. You're giving us your time, and we do value that. You're going to hear us talk about an amazing company. Devoted Health is truly an astonishing group of people with a fabulous mission, and I am just deeply, deeply proud to bring this company to my home state, and really excited to work with all of you. We'd like to make the work you do in your day-to-day jobs easier, simpler, and we want to make sure that the experience of healthcare for seniors is just immeasurably better. And that's what you're going to hear about, how we go about doing that. I really do appreciate the time you're giving us today. We value your time, and so we'll try to make really good use of it. And for that reason, I'll cut my remarks there and turn it back over to Mike. Thanks, everybody.
Great, fantastic. Thank you very much, Rich. So I wanted to shout out Oh, thank you. By the way, Michelle Jackson just sent the email address that you can send your request to for the gift card. By the way, you can actually call the number on the back of the card and verify if it's been activated or not. Just finishing that off. So I did want to give a shout out to Dyson. Dyson is the person who's driving our slide presentation today, so we're going to ask him to forward the slides as we need. So Dyson, let's go ahead and move to the agenda real quickly. Today we're really set out to accomplish a couple of things that are really important. We want to make sure that you're all providers in our devoted network, and that for which we are very, very grateful. We're very excited to be working with you. We want to provide you with some insight into who Devoted is, and as Rich mentioned, really what makes us different, how we differentiate ourselves from the other Medicare Advantage plans that are operating in this market. We're going to talk a little bit about our coverage area. I want to introduce you to some of the local Devoted health team members that you're likely going to be working with in the future. Kent Jacob, our sales leader, is actually going to walk us through at a high level a summary of our plan benefits, which, by the way, are awesome, and we're really excited to offer them to Medicare beneficiaries in Northern Ohio. And he's also going to provide a little bit of information about marketing support that you may be able to access and want to use. And finally, Emma Smith, one of our CREC network managers, and many of you may know Emma. She's going to give you a preview of the tools and resources that are going to be available to work with, for you to work with Devoted. I do mention that we will actually be hosting a deeper dive session to go deeper into those tools and resources so that you can, to make sure that you all know how to use them and they're operational and functional. So let's move on. Let's start with who is Devoted, and I think the right place to start is actually the folks who founded Devoted, Ed and Todd Parker brothers, and they actually have incredible depth in the healthcare and health technology field. They also have extensive experience working with government services to ensure that Americans, receive the right kind of healthcare. Ed and Todd, actually, one of the notable organizations that they founded was Athena Health. Many of you may be familiar with it. In 1997, they founded the organization which provides back office services to providers. They built that into a very robust enterprise, which eventually went public. Todd actually also worked for the Department of Health and Human Services and the White House directly. He was the first Chief Technology Officer for the United States. So we're teeing up a video right now, I think, which will help provide some insight around the principles that are really foundational to the creation of the company. So Dyson, if you want to advance and turn that video on, we'll play it. We're not hearing sound.
Isn't systematically seen. Far too many seniors don't get the best healthcare in the world. The problem is that the healthcare system as a whole isn't systematically wired to support doctors and nurse practitioners and other care deliverers to get people the best care in the world. Devoted's mission is to change all of that.
When you look around and you look at what's happened in the last 20 years, you see enormous changes that have been made in other industries. And then you look around at what's happened in healthcare, and it's like nothing has changed. We're stuck in the Stone Age. It is time for something different. It's time for a different kind of company to go forth and bring that kind of innovation to healthcare.
The reason we're in this business is so that we're solving problems for who we're serving.
So we have hand-selected a very high-performing group of primary care physicians.
Ending up with a smaller primary care network that has a backbone of a very large, high-quality specialist network, as well as a high-quality hospital network to work with.
Healthcare will always be about an interpersonal relationship between a doctor and a patient. And what we're trying to do is allow like the human interaction to really lead.
Across every industry that we're seeing being disrupted, there is one common element. They're all using new technologies.
Because we're taking technology that other kinds of consumer companies have been using for a long time. We're applying it in a space that has been using technology from the 70s.
Why do we need devoted health right now? It's the first time we've been able to actually put together the pieces that actually allow you to have a world-class patient experience.
No one's a number here. We want to develop that personal touch with each of our members to ensure that they are getting the care they need when they need it.
So we're very excited about where we're going, and we're absolutely freaking going to win.
Far too many seniors.
We can advance to the next slide. Thank you, Dyson. So I think that gives you some high-level insight into the principles that are really driving the model that is devoted health. And underlying that is our mission. Our mission is really simple, and this is really driving why, it's the basis for why devoted health is different. We're fully committed to treat every member like family, to ensure that they get the best possible care. And Todd and Ed have pulled together an incredibly talented team and very deliberately been identifying, and we are launching product across the nation, which we'll take a look at in a few moments. So how do we meet this mission? This mission is our prime directive. Let's go to the next slide, please. There's a lot of factors that really are crucial to creating a successful health plan enterprise. You need to have a great network, which we believe we have put together a phenomenal network with all of the folks who are attending this presentation and others. You also have to have great benefits, and you'll see in a few moments that we have a phenomenal array of benefits. But fundamental to what we believe is essential is that we earn the trust of our providers and our patients. And with a trusted relationship that's safe and secure, we believe that we will be successful and we will have the opportunity to radically transform and improve the delivery of care and the care that individual members receive. So how do we do that? How do we earn the trust of our providers? Really, the trust is based on doing the right thing at the right time, that we provide the information that you need when you need it so that you can properly care for and maintain that patient relationship. We want to get out of your way so that we provide the guidance and the support that you need, but we also get out of your way to allow you to make the right decisions for your patients so that they get the right care, right place, right time. How does this translate in terms of our relationships with our members? We literally view our member relationships as crucial to our success. And we think about a customer service activity as an asset, something that we can build on, profoundly build on that relationship with the members so that they trust us and they seek us out for guidance and support to our providers. We actually have a team of care guides, member guides, excuse me, and these individuals, they not only answer questions that you would typically find when a member calls a health insurance plan, like, how does my benefit work? Or I need help understanding the payment on my claim. Those are all questions that we definitely address, but we go much further and deeper than that. Let's move to the next slide. So we have this team of member guides who are focused on customer service with our members, and we also have trusted clinical experts that we call clinical guides. And this team of individuals is very focused on going above and beyond. These are the folks who are tackling downstream, blocking and tackling downstream to help the member access the care they need, to make sure that there aren't barriers to care and barriers to good health. If a member needs a prescription drug, we make sure that it's filled. If the drug needs to be delivered because they can't get to the pharmacy, we make sure that the medications are delivered. If a member needs nutritional support in the way of home meals, we have services that will provide those, and we can make arrangements to have meals delivered in the home. If a member needs transportation support to visit a primary care physician or another provider, we can accommodate that. We can actually make those appointments and arrangements for those individuals. We also are accessible and available to our providers so that we work in support and concert with primary care, specialty care, and other providers to make sure that this care is delivered in a highly efficient and effective way. Let's go ahead and go to the next slide. So you can see that we actually devote considerable resources to the member experience and the provider experience. And underneath that is actually a technology platform that enables this. So we did not go out and actually purchase third-party software and computers to administer all of the things that a health plan has to do. We built it internally, and there was a reason for that. We wanted all the information to be seamlessly integrated so that all of the folks who are touching members and touching providers have information available to them immediately on demand. The system also accommodates providing exceptional data that's accurate, timely, that may be delivered to providers as needed. And the system is world-class. It's actually an iterative system, which simply means that it can be changed on a daily basis if necessary to accommodate improvements, information that you might give us that would improve a report or the way something functions, or information that we've discovered in our interactions with members. It's very important that we stay current and to allow us to provide the best, most efficient service to our members and providers. Listed on this screen are a number of metrics that are simply measures that reflect the robustness of this system. We credential providers in less than 20 days. We're processing authorizations in less than 3 for standard auths, in less than 1 day, in fact, in hours for expedited auths. We're adjudicating claims 95% of the time in 3 days, often paying in 5 days. From a member and provider experience, we have real people answering the phones. 80% of the time, the call's answered in 30 minutes. And we're resolving member calls very quickly, same day, 80% of the time. We make ourselves available so that our medical directors can speak directly with providers on the phone if necessary. So let's go to the next slide. These things result, so do all of these things actually produce the result that we're looking for? You may be familiar with a concept called Net Promoter Score. Net Promoter Score is used across a broad range of industries, and it's simply a measure of customer satisfaction and loyalty. In fact, the question asked to get to a Net Promoter Score is, would you recommend this company to a family member or a friend? A Net Promoter Score range actually ranges from +100 to -100. The health insurance industry, unfortunately, has a notoriously low, average Net Promoter Score of 15. And the ranges for large insurance companies across the country ranges from a -5 to a high in the 30s. As you can see illustrated here, based on our 18,000 member sample, our current Net Promoter Score is a whopping 82. And to just put that into context, Apple, which everybody would be familiar with, has incredible customer loyalty, and their Net Promoter Score is world-class in the 70s. So this is a phenomenal measure of how we've integrated the customer experience, the provider experience with our technology platform to produce a great result in servicing our members. Let's go to the next slide, please. And one more. Our coverage area, Devoted Health was actually founded in 2017. We launched our first market in Florida in 2019. And in 2020, we expanded to the Houston, Texas market. We now are at about 20,000 lives. And in these markets, we have grown phenomenally. the growth rate was actually record-breaking in all of these markets. In 2021, we're proud to say that we're coming to Ohio, and we're also going to be expanding to Phoenix, Arizona, and there will be expansion markets in Texas and Florida in addition to our original launch markets. And the next slide shows us the service area that we're launching in Ohio. It's a 13-county area that includes greater metro Cleveland, Akron, Canton markets, and what we call the Sandusky market, which is actually the 5 counties to the west of Cuyahoga and Lorain counties. Next slide. I'd like to wrap up just introducing some of the key folks that are leading the Ohio market. So we can go to the next slide, please. Rich Waldron, as you've been introduced to, is the market president for Devoted Ohio. I'm leading the network team, and actually Kent Jacob, who is up in moments, is our sales leader, and he's going to walk us through benefits. We can go to the next slide. We have a phenomenal network team. Emily Henry, Leslie Cohen, and Emma Smith, many of whom I'm sure you know by now, are our network managers. They've worked in the local market. They're well-seasoned and experienced network professionals, and they'll be working very closely with your organizations as we launch and continue to operate the plan. And Michelle Jackson is the glue internally. Our internal network representative will help coordinate a lot of the information flow between our network team and a lot of the other departments within Devoted Health. Our marketing organization on the next slide includes Teresa Motto. She is a local market leader for Devoted Ohio, and she comes from a health system, a large health system based here in Ohio, and she's also an Ohio resident, supported by a very strong marketing team headed by Nancy Go, our Chief Marketing Officer, and Linnea Connolly, who supports a lot of the provider marketing activities that you'll see and have probably already seen. So I think that rounds out my portion of the presentation. If Dyson, you want to move us forward, and I'm going to turn it over to Kent Jacob.
Good morning / good afternoon, everyone. Thank you, Mike and Rich. My name is Kent Jacob, and I'm the sales leader for Devoted here in Ohio. And I want to thank everybody that's joined us today, and thank you for carving out time for us. I know you all are extremely busy, and just want to jump right into our plan highlights. We will have 3 offerings that we're bringing into Ohio. And I will tell you that although Devoted is new to Ohio, we certainly are not new to Medicare. As Mike touched on, we are the fastest growing Medicare Advantage plans in our other existing markets. And we are taking that enthusiasm and energy on the road as we expand into Arizona and Ohio. We have, as I mentioned, 3 HMOs that we are bringing into the market. The first one that we have up on the screen is what's called our Core HMO. This is a $0 monthly premium plan. The Core plan is an excellent middle ground plan in that it hits the sweet spot for our members between a strong value proposition for a $0 monthly premium. I'm going to encompass all of our highlights and our extras in just a moment, but the Core plan, I would say one of the most distinctive things about the Core plan is the drug benefit that's built into this plan. We do not have a drug deductible in the Core plan, so that is waived. And the tier deductible for tiers 1 and 2 is 0. So for most of your patients, about 2/3 of all the meds that they take fall into tier 1 and 2. So the Core plan is an excellent provider of drug benefit along with all the other Core benefits in that it has no Part D drug deductible at all and 0 through tiers 1 and 2. Next slide, please. The Prime plan, I love this plan. It really helps a lot of patients on both ends of the income spectrum. For patients and members that are low income subsidy, or what's called LIS, They will not have a monthly premium in this plan. The premium is pegged around $22 per month, but if they qualify for low income subsidy, again, they will not have a premium. What I love about this for low income subsidy patients is that it allows them to get similar benefits that they would find in a dual eligible plan. For example, they get $2,000 of comprehensive dental, excellent drug coverage, really, really low copays, all for a zero premium. And on the other end of the income spectrum, for folks that maybe have a Medicare supplement plan, this is a great fit for those folks because they're going to bring their premium down to about $22 a month and experience incredible benefits, including that dental, vision, and hearing. And then our next offering that we have up on the next slide is our Saver plan. The Saver plan is frankly, we're extremely excited about this because frankly, it's the first Medicare Part B give back plan in our 13 counties for a Medicare Advantage Part D plan in the history of Ohio. What that means for our members and your patients is they'll pay zero premium per month and get back $50 per month into their Social Security checks, or $600 per year. This plan is a fantastic fit for veterans. Obviously, they can continue to use and access their VA benefits, while at the same time getting additional coverage through the Saver plan and $50 back into their Social Security check. And a little bit more about that as we proceed here. And the next slide, please. So, what is the best fit? Well, that is obviously going to depend on the Medicare beneficiary's current situation. But for the Saver plan, folks that maybe are a little bit more budget conscious, healthy consumers, the core is a great fit for folks that want to pay zero premium but really have access to strong benefits with $1,000 worth of dental in that plan. And again, fantastic drug coverage. And then the Prime plan we just touched upon. And next slide, please. I want to take a moment, and Mike started off, and Rich mentioned this as well. What makes Devoted different? I know that you guys and all the folks on the call, that you deal with a lot of payers and insurance carriers on a daily basis. So who is this new company? Why are they different? What's the Devoted difference? And I would have to say that in a global sense, it is 360 healthcare. We do provide incredible core fundamental benefits, but that Devoted extra is really what separates us from the pack. And, Devoted really has now made the transition from a health insurance carrier to a health care company, in that we support 360 healthcare and really those things that drive your patients to be proactive about their own health care. So just a few things that fill that description and kind of add some color to our benefits. Number one, all the plans include a personal emergency response system, the acronym being PERS. What I love about Devoted's personal emergency response system is it travels with your patients, with our members. So if they're traveling, the device goes with them. It's a pendant that goes on a necklace. So whether they're cycling or hiking, and as I said, traveling out and about, if they have an emergency and they need to access emergency responders, they can do so instantly wherever they are. It also includes the home monitoring station, and all of the fees for GPS and the monitoring are covered by Devoted in all three plans. And fall detection is going to be added for 2021, and so all new members in Ohio will have that included as well. I will tell you that in our other markets, the grandchildren and children of our members love knowing that grandma or their dad have the PERS device, and it just gives them a feeling of security, knowing that if something happened wherever they were, that Devoted would help them get in contact with assistance if needed. Acupuncture, as you probably know, was something that Medicare added as a benefit that needs to be covered. A minimum of 6 visits. Devoted goes a step further by offering 12 visits per year in our plan. We are now covering a bathroom safety equipment, a raised toilet seat, or a standard tub seat. The next slide, please. All 3 of our plans include silver sneakers, but we go that Devoted difference one level beyond providing basic silver sneakers, and we call it Wellness Bucks. As we all are living in a COVID environment, many seniors are not able to get out and access, gyms, training classes they were in, silver sneakers classes that they're in. So Devoted decided to help them on their healthcare journey along the way by giving them Wellness Bucks. For example, in the Saver Plan, and the Saver Plan is the plan, again, that's 0 premium, gives them $50 a month back in their Social Security check. We're going to give them $300 per year to buy gym fitness equipment. We're going to give them that $300 that they can use for a lot of the things and more that you see listed here. For example, they can use that money towards a Fitbit watch or an Apple Watch. We've got a lot of members, because they can't get out and go to silver sneakers classes, have gone to Walmart or Dick's and bought a yoga mat and stretchy bands, some little dumbbells, and we are reimbursing them up to $300 in that plan. It's really important, as you know, for your patients to get out and stay active, and if they can't in COVID, this is a great way for them to stay engaged. So as we come out of COVID finally, they're up and running already and ready to hit the trail, so to speak. So I love that benefit. Devoted Dollars, now this is unique in that when your patients access preventative care, be it a PCP visit, a flu shot, hopefully soon their COVID vaccine shot, cancer screenings, mammograms, etc., we are really trying to promote patients being advocates for their own health care. When they do access our preventative benefits and preventative visits, we are going to send them a prepaid Visa card that will come automatically in the mail. The neat thing about this is they don't have to hassle with claim forms or reimbursement forms. These are claims triggered. So they go get their flu shot, and in about 2 weeks, they're happy when they open up their mail to see a prepaid Visa card with a card from Devoted thanking them for embarking on their healthcare journey with us. Next slide, please. Marketing support. I want to tie this into what Mike brought up very well, which is our Net Promoter Score. So we have the highest Net Promoter Score of any healthcare company that's ever been recorded in the United States. And again, what does that mean for your patients? What that means is that when a Devoted member or a Devoted patient calls in for any kind of help, be it they need a new member ID card, they have a question about a claim, that experience is like none other. The average healthcare score, Net Promoter Score, is around 15. And I encourage you, when you have just a few moments, to Google the Net Promoter Score of some of the carriers that you have now currently. And I think you'll be surprised to see that our score, as high as it is just truly remarkable. And it expresses and reflects the dedication that Devoted has to providing 360 healthcare for our members. Marketing support. So next slide, please. We have an internal sales team here in our 13 county footprint for Devoted. We have also community outreach specialists. So soon you will be seeing, following COVID protocols, of course, a representative of Devoted that will come into your offices, obviously pre-arranged to make sure it's a good time, and we're following, of course, all protocols. But we want to make available to all of you the following materials and collateral that we have. So as our representatives come around, meet with you, and introduce themselves and begin to form a relationship with you, we want to just give you a peek at some of the collateral materials that we can offer. And we know everyone's office is a little bit different, so they will size those up, the physicality of each location, and follow your direction on what you think would be appropriate. And before I hand this back over to Mike, I do want to say that a couple of other things. I mean, this is a very long list, and I don't have enough time to really jump into all of this. But for example, Devoted is now participating in the senior savings model. What that means for your patients is we are capping insulin at $35 per month, even through the gap, even through the donut hole. And you know that insulin can be a crusher. It can kill their budget. It can be very painful financially. And this is a big game changer in Ohio to be able to cap that insulin at $35 per month. Our mail order, our 3-month mail order supply, we have bumped up to a 100-day supply. We do include over-the-counter in all 3 plans, and they can get those benefits through over-the-counter, through ordering online, through our catalog, over the phone, and we ship those items to their homes free of charge, of course. We do not stack copays under observation. We've waived the 3 in-hospital day stay for nursing home. We don't stack copays in the doctor's offices either. Vision is covered. The hearing aid, I don't want to go into too much detail, but it's unique. It's a game changer for folks that need to get a hearing aid, and quite frankly, they're very expensive. The Devoted Way gives them access to the best hearing aids. Some of them include Bluetooth technology at a low predefined copay. Transportation is included, and I can tell you that in our other markets, the mileage limit on transportation is capped at 30 miles. When we came into Ohio and knowing the geography and the access to these great hospitals that we have here, we knew it was going to be important to extend that geographic range. So we offer unlimited trips to the PCP offices up to 50 miles. We also offer trips to pharmacies, physical therapy, to the VA, etc., all built into the plan. Dental, again, the core plan, which is $0 and has that amazing drug benefit, it gives your patients $1,000 a year in comprehensive dental that includes dentures as well. Meals, of course, delivered in the home. I love this one because this really, to me, just screams, just going the extra mile. We do give in 2 of our 3 plans $500 a year for wigs for patients that need or that have hair loss and they're having chemotherapy. This is more of an emotional support benefit, which I love, and that ties into just another one. And I could go on and on. I know I'm going to run out of time here, but for instance, if you have a patient that is getting a injectables for chemotherapy, for example, and let's say the vial is a 10 cc vial, the drug administered, the amount is only, say, 5 cc's. Well, they have to throw in the trash the unused portion. The insurance carriers are always billed for that full portion, as well as Devoted is too. But we only bill or charge a copay for the amount used to support folks on that very difficult journey through recovery from cancer, and on and on and on. But I'm really, really excited to be here, and thank you again for taking the time to allow us to come into your day. Really looking forward to myself and our team getting out to meet all of you. And as you spread the good word about Devoted, our contact information will be in there. Feel free to reach out at any time, and look forward to meeting you all soon. And thank you very much, and back to Mike.
Thanks a lot, Kent. That was a phenomenal overview and a lot of information to absorb in a short period of time. We are actually sending out materials to you all, and that will include a very comprehensive review of our benefits, so that all of this information that Kent just shared, you'll have access to. So at this point, and to round out the formal portion of this presentation, Emma, you're on, and Emma is great network manager, and she's going to give you a little preview of the kinds of things that you're going to need as we move into the implementation phase of operationalizing the plan with you all. Thanks. I think you're on mute, Em. I'm not sure. Well, I'm not hearing you, unfortunately. Are you there? Okay, Emma's going to call in. Dyson, do you want to go ahead and advance to the next slide? So we have about 4 or 5 slides that we wanted to talk through, and while Emma's trying to get online, unfortunately, this is one of the challenges of a virtual meeting is technology doesn't always cooperate. So let's go ahead and go to the next slide, and I'm going to try to wing this. She's the expert here, right, today? Maybe I can get us through it. One more slide. So one of the really important ways that you're going to be working with us is through our Devoted Health Provider Portal. And this is actually accessed through your Availity account. There are a lot of very important activities that you can perform in the portal. Of course, you can check member eligibility. You can submit prior authorizations. We actually will not be requiring referrals in Ohio for specialty care other than PT, OT, and speech therapy. You're able to submit your electronic claim submissions, review remittance advice, etc. But in this space, we also we provide a lot of very important information, and you're going to be quite excited because oftentimes it is real time when the report is structured that way. And so you're going to be receiving quality information, information about your patients related to HEDIS, STARS, and risk adjustment reports. All of this information will be very useful as you work with your patients. And Emma, it looks like you're in. All right, I'm going to give it back to you. But you can see the email address here at the bottom of this slide to access the portal. Oh no, your phone is muted. Can you unmute your phone? All right. Okay, Dyson, let's go ahead and move to the next slide. I'm very sorry, folks. There are some, to access the reference tools that you typically would want to find related to a health plan, you can visit our website, which is simply devoted.com/providers. You can actually today, if you access that website and select Ohio, the Ohio market, you can access our quick reference guide, which is published. That actually lists all of the prior authorization information that you need to know about. And again, like I said, we don't require referrals at this time. And there are also some key phone numbers on that quick reference guide that will help you navigate the Devoted world. We also have our full provider manual now published and on this website. You can access our provider directory. You can search thoroughly the provider directory. Also, you can search our formulary for approved drugs and tiers. There is information about the authorization submission process that you would want to follow for certain types of care that require authorization. And finally, there are tip sheets that you can access as well. Let's go to the next slide. This is an example of the reports that you can receive through the portal. Actually, there are 2 ways you can receive reports. And depending on your organization, some organizations want to receive an actual data file that you can load into another system and manipulate. And that would be through a secure file transfer protocol, or SFTP. We can actually get you set up to receive reports in that fashion. But you can also access all of these reports through the portal directly. One of the advantages of utilizing the portal is the information is real time at any point in time. There'll be plenty of additional information available to you when we have the next operational in-service. So let's go to the next slide, please. One thing that we really want to remind everybody, it's super important that your provider information is listed correctly in our directory. Folks really rely on these directories when they're accessing care. So we want to make sure that office addresses, phone numbers, et cetera, is all up to date and accurate. When you receive this slide presentation, if you click on the template word in the presentation, you'll actually find the template that you can utilize. And most all of you, in fact, all of you have actually submitted rosters. We're just simply asking that you keep the provider information up to date by submitting rosters. That information is sent to credentialing at devoted.com. And let's go one more. Finally, I did want to mention, or we want to mention actually, that we are maintaining constant communication with our provider community and with our member community concerning late breaking information about COVID-19 testing and treatment. Devoted Health, in the spirit of really going above and beyond, we have worked very, very closely with our providers in our active markets to ensure that we understand what's available to our members in those markets vis-a-vis our providers, and that we're communicating that information to our providers or to our members. We actually, during the when the pandemic really kicked in, we started a campaign, and we've actually contacted directly every single member in our networks or in our markets that we're operating today. And really the outreach was designed to make sure that all of our members are continuing to get the care that they need during this very challenging time. So we'll keep you updated through a coronavirus provider information link that's also available. And I think that's the last slide. Let's just advance one more. Oh, I'm sorry. This is an example of our member ID card, obviously critical information as members present for care. And let's go one more. So really, we're here to help this implementation go super smoothly. We are available if you want to reach out to your network manager. You can also contact the provider service number listed here. We'd be happy to arrange for additional time with your staffs and your respective organizations if you'd like to learn more or just extend additional information to a broader group of individuals that will be supporting our efforts. That's really the formal presentation. I wanted to open up the floor for questions, and like we said early on, you can use the Q&A chat function. We have about 12 minutes or so left. If you have any specific questions about anything, really.
Mike, while we're waiting, maybe I could, somebody's dog has gotten loose. While we're waiting to get your questions, I really just wanted to sum up in this way. Devoted is going to be a breath of fresh air for all of you, for the whole state of Ohio, really. Other payers, whether inadvertently or not, create barriers and obstacles to you getting your work done. And we want to be here to solve problems and to make things better for you and to make healthcare easier for your patients. We're here in town, and I hope you'll call me. I hope you'll call the staff. I hope you'll call the Devoted team, because we really want to be here for you. And so with that, I guess we are starting with some questions. I'll turn it back to Mike to lead us through those.
Awesome. Okay, so there's an anonymous viewer. Are there any plans to expand beyond the current target counties in Ohio? That's a great question, and I'm going to answer this two ways. And the reason I'm answering it two ways is because I noticed some of the attendees today are actually have locations outside of our current 13 county service area. So if a provider is located outside of the service area that the member is enrolled in, they can, if they have a contract with Devoted Health, they can still provide care to those members. So I just wanted to reinforce that for those of you who are actually operating office locations, if you have a contract outside of our service area, you can provide care to those members at your locations that are outside of the service area. Hopefully that was clear. But the real specific question that you asked here is, are we planning on, do we have expansion plans? And the short answer is absolutely. You know, we are locked into our current service area for 2021, but we have actually been looking very hard at expansion beyond the service area for 2022. And Rich, I didn't know if you wanted to offer any other thoughts about that.
Yeah, I'll give you a little teaser. I actually have just been talking to the legal department, and we are filing what is called a service area expansion filing with the Department of Insurance. So we will be expanding, but I have to keep it secret on where. So call me if you want to talk, and we'll chat about where we might be going next. But the intent would be to cover Ohio in a really broad, deep way in the coming years.
Okay, thanks a lot, Rich. Jamie asked, how do you process payments to the facility? Is ERA EFT available? And the answer is yes. So I'm just gonna kind of wait to see if we have any additional questions come from our participants. We do have 9 more minutes. And for those of you who were able to order Subway, I hope you enjoyed it.
Hey, Mike, I was thinking one question that we got the last time we spoke to a group of provider representatives. We got a number of questions about travelers
Yes.
and specifically about snowbirds. And I thought while we're waiting for additional questions, I could let people know at this point, we're coming to Ohio as an HMO. So we will want you to, the patients to stay in network with their Ohio providers. There's a way you can file a travel benefit, and we're looking at doing that since we will have a large provider network in both Florida and Arizona, typical place for snowbirds. While we don't have that yet, that's coming online, and we'll probably also expand into a PPO because that has become such a common question people ask. So if that's an interest or something you want to discuss, let us know, but those things are in the works as well.
Thanks, Rich. Absolutely. So I'm not seeing any new questions coming up. I do want to reinforce with everyone that we're just super excited to work with you. I know that there are a number of folks here today that we've been working with who are part of various health systems. And to the extent that it would be helpful and valuable, we can make ourselves available to work with you all to deliver this kind of a presentation to your staff just for your particular organization. So I see we have another question. Laura Pelfrey, since this is an HMO plan in Ohio, are the members required to choose a PCP? And if so, are they required to see only that PCP, or can they see anyone in that office? It is an HMO that does have a PCP assigned to the members. So we are requiring that members choose a primary care physician, absolutely. We do allow for members to see PCPs in that common office as well.
Yes.
You're welcome. Thank you. And again, I just want to reinforce, this is not a plan that requires referrals. We do ask members that they consult their primary care physicians if they need specialty care, and that's clearly described in all of our member materials. We really do rely on our primary care physicians to lead the care that's provided to members, and ensure that, you know, all of the preventive services are received throughout the year. And I see we have another question. Do members have to use a particular pharmacy or a mail order pharmacy? We actually have a very, very broad pharmacy network. We work with CVS. And so there's virtually every pharmacy that you can imagine is included in the network. We've paid particular attention to organizations that actually own their own pharmacies. And I'm thinking of a few health systems that do that. And we've confirmed that those pharmacies are in the network. And the mail order would certainly be through CVS as well. Another thing that we can note that I just wanted to bring up, and Kent might have a comment or two about this. We've gone through a very extensive effort to work with brokers in the service area. And, you know, I'm just really excited to tell you that we have a very large network of brokers who are super excited about our benefits and very excited to sell the Devoted product here in Ohio. So I don't know if, Kent, you wanted to make any other comments about that.
Yeah, thank you, Mike. I would add to that we just want to make sure that we meet our members and your patients where they want to be met via the internet. With COVID could be a little bit challenging, right? As we reach out to folks and they want to explore or join a Devoted Health plan this fall. So wherever a potential member or one of your patients wants to interact with us in any way, be it over the phone, be it through the mail, be it over Zoom or the internet, even phones, through our someone from our sales team will be there really to meet them wherever they are. So we're very pleased to have such a really broad support system in all 13 counties. Every corner of all 13 counties, we have had remarkable responses from the broker and the sales community, and we are very, very happy to be bringing that as a support to you and your patients.
Okay. Well, I think we're gonna, it's 12:58. I'm sure everybody needs to get back to whatever you were doing before you joined us. I just really want to thank everybody again. We're so excited to be working, and we're so honored to be working with you. So just as a reminder, the annual enrollment period kicks off in 7 days, and members will start to receive information about Devoted Health. And it's quite likely that folks will start contacting their providers to confirm that you all are available and participating in the network. So I would just encourage you to spread the news, you know, spread the word widely, make sure that the folks who are touching patients, interacting face-to-face and on the phones know that we're here, know that you have a contract with us, and we would really appreciate that. So thanks, everybody. Have a wonderful rest of the day.
Thank you all.
Thanks, everyone. Be safe. Thank you.